From the BSG's perspective, what's important about the registry is the ability to know more. And there's two perspectives to that. One is for our doctors to know that they're doing a good job, to be able to compare themselves with a trust in a different part of the country, to be able to see how their patients are doing, even to compare them as a group. Then there's that same information, knowing what we do from a patient perspective. IBD is a complex disease, or complex diseases, and people have different outcomes, and having a picture across the country and within trusts about how people are doing is incredibly important. And there's two sides to really knowing more about something. There's a research element, which is important to us, because we don't know as much as we'd like to know about how patients respond to treatment, and we don't know as much as we'd like to know about whether patients are managing when there is such a large group of patients that need to see hospital doctors, and obviously hospital doctors are under greater strain. So increasingly there's a large number of patients who may not have seen a hospital doctor for some time, so to have the ability to be able to record information better gives us a much better overview of that patient population, both in terms of knowing what we do best and knowing how to make things better for patients too. I think what's really valuable about the registry, potentially, is an ability to do things differently. Because right now, we've tended to manage care in quite a traditional way. You start to have symptoms, you go and see your GP, there's a fear that it could be organic disease, and so you're referred to a hospital, you may be diagnosed, and then you'll be followed up over a course of time. It's a fairly traditional model, and with constraints on hospitals, as I just referred to, it can be quite difficult to manage patients as well as you'd like to because of the time slots being available. Already in the sites that are adopting the registry, we're starting to see a little bit of change. We're starting to see that they can monitor their patients in a different way. They don't always have to come to the hospital, but they can report their symptoms. They can be monitored remotely, which means that they can record their symptoms, that they be able to telephone a department, which hitherto hasn't been possible. It's hardly rocket science to pick up a phone, but it has been pretty difficult in the National Health Service to be able to telephone a consultant and to get advice. The registry enables us to do that and to record that interaction with the patient, and then over a course of time we not only have a rich, detailed file on that one patient, but on the thousands of patients all over the country, so we know much more about it. There are two other elements to this really. One is that the model that we're using here of trying to collect national data on a set of patients isn't just right for IBD, but it could be right for lots of conditions. And we hope that we are stepping forward and taking a risk and showing that this new approach of working can be adopted across medical specialties, and that patients will get a better outcome as a result. We'll know more about how patients are managed as a result. And in the case of IBD, we'll know more about the condition itself. IBD is complex. We don't know what causes IBD, and we don't know how to cure it. There is no cure at the moment. In the BSG, and our members who are predominantly consultant gastroenterologists, but also a lot of specialist nurses specialising in IBD, we are trying to lead the way in finding new ways of caring for people. And to do that we need new resources, and having a rich data source on individuals' health, but also on the whole population, we think will give us those insights that will really help us to radically transform the way we care for people. And we hope that the great discomfort and pain that's caused by IBD can be much better managed in the future, because we recognise, as you say, this is a chronic condition. We can't cure this condition. People are living with this forever, and we want to try to really better understand it, better understand how we can improve quality of life, and ultimately, of course, how to challenge the disease itself.